Hello, everyone, and welcome to Leverage Data for a High-Touch Innovative Patient Engagement Strategy, presented by Deloitte. I'm Rebecca Williamson, the publisher of the Life Sciences Group, and I'll be moderating this webinar. Our speakers today are Christopher Zant, Principal at Deloitte, Ryan Myers, Principal at Deloitte, and Amarinder Sidhu, Patient Connect Product Manager at Deloitte. You can read their full bios on the left side of your window. I've got just a few notes for you before we begin. If you'd like to download the slide deck, please click that Files button at the lower left corner of your screen. The webinar is being recorded and will be available on demand within 24 hours after the event. And we'll be following the presentations with a Q&A session. So please submit your questions during or after the presentation using that Q&A button in the lower left corner of your screen. All right, that's it for me. I think we're ready to begin. Chris, please go ahead.
Thanks, Rebecca. I appreciate the opportunity to be here, and welcome everybody. We'd like to share some material around our perspectives on data, patient engagement, patient experience, and how you can leverage that to drive real connection with patients in the life sciences industry. As we mentioned, I'm Christopher Zant. I'll be your first speaker, and we'll introduce the others as they come up. We believe there continues to be significant change and opportunity in the healthcare ecosystem for life sciences. You can probably look at a slide like this 2 years ago and 2 years from now, and there may be different compass points there, but the principle is we continue to face questions and challenges around how we get from volume to value and how precision medicine plays in how we treat patients, how the changing stakeholders in our ecosystem and the environment between them is important, and how evidence and the increasing demands on our businesses to understand what evidence we can truly produce that our therapies and the services we provide around them are producing value is increasingly important. So our clients and broadly life sciences organizations are continuing to drive towards new customer-centered patient engagement models to address these challenges and to improve patient outcomes. If we look from a time perspective, just a year or 2 years ago, although these changes have been happening for some time, we saw a lot of fragmented execution and duplicative solutions and capabilities in the market. Some companies were leading with unique and innovative patient services solutions, and other companies were unable to leverage data directly about patient and the health ecosystem around the patient and the caregiver and the model that was in place. We've seen a distinct move to more holistic interactions, and we see a path towards a future that we believe will be truly dynamic and holistic with coordinated patient engagement supported across the life sciences enterprise. We think there's no stopping this transformation. Patients are now at the center of healthcare. They're interacting in all different ways and in new ways. And we believe life sciences and biopharmaceutical companies need to embrace that model. So I think the end state over the next couple of years, at least the desired end state, is very clear. But today, we're in that fuzzy middle ground. Companies have different degrees of capabilities within individual life sciences companies. We see very different and distinct capabilities by brand, by therapeutic area, or even within some of the larger brands by indication and specific therapy. And that disconnect and that variation across the capabilities that are available is confusing the market a little bit, but also creating a lot of opportunity for companies that embrace a view that includes direct patient engagement and leveraging capabilities to do that. So to get there, we think our life sciences clients need to play a significant role with patient and be prepared to respond to some of the key changing dynamics that we see. It's greater patient empowerment. Patients are a lot more involved today. The digital world and the multi-channel world is making it easier for patients to be directly involved with their treatment. The emphasis on value and how we measure that value is creating a significant pull towards the importance of around the therapy services, especially crowded markets and high-cost therapies. We're seeing real distinction in the value that's being created where we can demonstrate services and a true understanding of the patient through data and analytics versus therapies that are in the market that don't have those wraparound services and ability to understand that. That leads to that shift towards relational and holistic care. How do we care for the whole patient and use the information available to us as well as the therapies that we have in market to really treat the patient holistically. And as I'm sure you've all seen in your own lives, the consumerization of the patient. And we now expect to be engaged with our healthcare in the same ways we expect to be engaged with consumer products and other retail and high tech and other ways in which we engage in the market. So, I want to use a website, use a mobile app, use SMS in a more commercial way as it relates to my healthcare. We're not fully there yet, but that move is happening, and I think the companies that embrace that move will be leaders and will have the ability to really get to this vision of tomorrow. So as it relates to those themes, and some of you may have been on one of our previous webcasts where we conducted a survey, but Deloitte Digital conducted a survey across both a webinar and the i4Pharma conference earlier this year to ask our clients and other members of the life sciences ecosystem and attendees at the conferences how they felt their organizational readiness and capability to handle some of these transformations stood. And we learned some interesting things. So there was a lot of movement in this space. And on the first chart there you see folks have done something, but self-assessment of the organizational readiness for providing patient engagement services indicated we were pretty low on average in the continuum, about 70% towards the bottom half of that continuum. But on the same scale, when we asked where those organizations wanted to be in 2 years, that you'll notice a significant shift. Almost all of that 70% moves up to bar 5. Folks want to be much more capable and enabled as it relates to patient engagement and the ability to support those services. So as you'd expect from that data, there's a significant portion, about 70% of the life sciences ecosystem that is leveraging patient engagement services and using them today. But the maturity is a bit all over the board, from the 30% that aren't doing anything back towards that significant number that are in the early buckets on that evolution. So a lot of interest, a lot of acknowledgement that the space is important, a significant desire to be advanced and potentially leading as we look 2 years out, but also a lot of question around how we get there and a lot of transformation needed to make that happen. We also asked what it meant organizationally to engage with patients and what execution models folks were using. I was very pleased to see that there was a lot of acceptance across the many possible channels for interacting with patients. What channels are being used on the top and what channels with patients on the top and with providers on the bottom shows a strong recognition that many of the digital channels that we're seeing in other industries and in that the consumer space and outside of life sciences are now becoming critical to our interactions with patients, just like they are to the general population of more broadly consumers. But enabling all of those channels and delivering patient services in a consistent, coherent manner when we're looking at them across not just a call center or not just having a brand website does complicate the situation. It creates a need for technology and a need for capability to connect the channels, understand who the patient and provider are, have a single view of those, of the patients and providers, and creates technology capability needs. So when we look to how organizations rated their ability to use these tools, again, you'll see quite a bit of variability on the bottom left. Sort of a peak around the somewhat able, but also that big collection of folks that aren't doing patient services yet still standing out there in the not given section. And from a technique perspective on the right, you can see that we're also looking to really the majority of folks want to be both responsive to patients and their needs, but also proactive and able to understand and reach out to individual patients. So as we aggregated the commentary and the thinking from those surveys and those discussions and our conversations with our life sciences clients, we've developed a set of core questions that you should really be asking yourself as you think about what kind of capabilities, offerings, and products make the most sense in this space. This material is in your handout. We won't be asking these questions today, but we thought they'd be interesting context as you consider the initiatives you have in place and the initiatives you may be bringing forward in the near future to think about patient-related capabilities, the technology and data that may be needed to support them, and the offerings you might want to release in the marketplace. So coming out of that session and thinking about all of that available information, we've consolidated a lot of our capabilities, offerings, and solutions, and have established a strong position for where we believe patient engagement should move forward. I'd like to ask Ryan to step up and talk about what we're focusing on with a lot of our clients and how we're seeing those things change in the marketplace.
Thanks, Chris. Appreciate it. So I wanted to take a few minutes and cover a couple different topics. First, I wanted to talk a little bit more specifically about what we've seen in the industry and what we believe good patient engagement model looks like, and what a good patient services program looks like. And then I'm going to spend a few minutes talking about a product that Deloitte has called Patient Connect, and how Patient Connect can be used by a life sciences company to enable their patient engagement programs. Chris spent a lot of time talking about the patient, and obviously this whole discussion is around patient engagement, and the patient is and should always be sort of at the center of all of these programs. But what we have seen in the industry is that the most effective patient engagement programs provide value not only to the patient but also to the healthcare providers. I'm going to give you a few examples of what I mean by that. But when we think about a comprehensive patient services program, we think about 5 different dimensions. The first being financial. Many companies have had patient services programs for a long time. Historically, it's been a lot of the biotech companies, for example, that had more complex therapies that were injectable or infused products, and products that were often costly, and therefore they've often offered services around financial assistance, services to help patients understand what their health insurance benefits are and how they can go about getting access to the medication, and helping them figure out what their copay might be before they start on a therapy. These financial or reimbursement assistance services also provide value to the healthcare providers. There's oftentimes a lot of administrative work and paperwork involved that the doctor's office needs to complete to help with a benefits investigation, or to help the patient receive a prior authorization to use a therapy, or maybe even appeal a claim that's initially been rejected by the health insurance company. A good patient services program also provides the therapy and training on the therapies and just general patient education. I mentioned the biologics and specialty pharmaceuticals that are injectable, for example. A good patient services program will have field-based nurses, nurse educators, clinical coordinators, a lot of different terms for these folks, or even people based in call centers that can talk to patients, that can train them on how to perform the injection and help sort of ease their fears on performing an injection, and which in turn helps patients feel at ease with using the medication and starting the therapy and then staying on therapy for longer. In some cases, for products that aren't necessarily injectable or infused products, some companies are providing patient education, and sometimes this is less about the actual product, but more just around lifestyle in certain therapeutic areas like diabetes, for example. Good patient services program is nurse educators that are meeting with patients and helping to educate them on sort of their lifestyle and what they can do to better control their blood sugar, for example. The fourth point here around engagement, I realize that's a fairly broad term, but by engagement there we mean sort of ongoing support and adherence. That once you start on therapy, depending on the therapeutic area, depending on the side effects of the product, patients will often discontinue. And a good patient services program helps to identify patients who are at risk of discontinuing their therapy, and allow the life sciences company in conjunction with the healthcare provider to potentially intervene and understand what's causing the patient issues and why the patient's at risk for discontinuing. And then the fifth point is around clinical. We've seen some patient services products and some products that are fall under REMS programs that do require sort of the next level of patient engagement, if you will, another level of data capture, whether you're capturing sort of lab results or the results of a blood test before fulfilling a prescription. A good patient services program for a product that is part of a REMS program will enable all those processes as well. So I mentioned a minute ago that Deloitte has a product to enable patient engagement and patient services programs. It's a product that we call Patient Connect. We recently released version 3 of our product last week. For those of you who are interested in technology or may have attended the Salesforce Dreamforce conference last week, we launched it at the Dreamforce conference. Our solution is built on Salesforce.com. It's built on Salesforce's most recent product that's specific to the life sciences and healthcare industry called Health Cloud. I'm not going to go into a lot of any technical details at this point in time, but on the next slide we'll spend a minute to talk a little bit about the different sort of capabilities that Patient Connect provides and different services that it can enable. You know, I've talked a lot about patients and the value that Patient Connect and a good patient services program can provide to healthcare providers, but that also extends, you know, well beyond the actual physician to the broader healthcare or broader care team. So for some therapies, you could be dealing with office staff and nurses nurses at infusion centers. Patient Connect and a good patient services program that enables that collaboration across all of the different people who are involved in the provision of care to a patient. And it could be a family member as well, through the various multi-channel engagement capabilities that Patient Connect provides. So I wanted to take a minute and talk just in a little bit more detail about the Patient Connect product, and then I'm going to hand off here in a minute or two to my colleague Amarender, who will go into a little bit more detail about the product and tell you more about how clients have used our product in the past to enable their patient services programs. But it's a cloud-based platform. For those of you who are familiar with Salesforce, it's a cloud-based capability. It includes multi-channel engagement. So by that, we mean it provides the ability for the life sciences company to engage with patients via the telephone. It includes pre-built sort of connectivity to the telephony systems to enable engagement over the telephone, engagement through websites and portals, as well as engagement through email and other digital channels such as SMS. And in some cases, as I mentioned earlier, we've got clients that have field-based nurse educators that are using apps that can connect into Patient Connect on the back end to facilitate their interactions while they're in the field interacting with patients. I mentioned apps briefly. We have several clients that are developing apps for patients to manage their conditions in the area of psoriasis, for example, or rheumatoid arthritis. Chronic conditions where physicians often encourage patients to keep a diary of how they're feeling. If they've got rheumatoid arthritis, for example, keeping a diary of when they're experiencing flare-ups, for example. And we've built apps that allow a patient to capture that information electronically and transmit that information back to the physician through a physician portal or an HCP portal that would provide detailed data as well as summary sort of metrics on how the patient is managing his or her condition. I think some of the key benefits, I've touched on a few of these already, of Patient Connect is that it can help to accelerate access to therapy. I mean, all the financial assistance and reimbursement assistance allows the life sciences company to play a role in helping to remove some of the administrative burden from the patients as well as from the doctor's office and get patients access to therapy more quickly. Life sciences companies are collecting a lot of data that historically they haven't had access to, data about the patients and how they're doing on therapy, which will allow them, life sciences companies, to better quantify the value of their medicines. I talked about the healthcare provider partnerships, where some patient services programs are facilitating sort of the interaction between the patient and the doctor, like the example I provided just a minute ago of providing So that information that the patient's entering into an app and providing it back to the doctor, it really allows the doctor an easier way to keep in touch with their patient and better understand how their patient is doing over time. In some cases, too, the product provides a portal, an HCP portal, that will allow a healthcare provider or office staff at a doctor's office to log in and see how many of their patients are still on therapy and again, which patients are at risk of discontinuing. So before I hand it off to Amarinder, I was going to take one more minute and just provide, I'm not going to go through the slide in detail, I know there's a lot of detail on this slide, but provide you an example of how one global life sciences company is using the Patient Connect product. They have a series of patient services programs that had been outsourced to a series of hub vendors, and across their major markets and across all their different brands, they had 30, 40 different hub vendors supporting their patient services programs. And this company also struggled to get access to the data that was being generated and captured through these programs. So their strategy was, number one, was to consolidate the number of vendors providing these patient services. And number two was to bring the underlying technology in-house. And because with Salesforce, it's a cloud-based platform, it was very easy to continue to use the hub vendors to provide the patient services and support the patient services programs, but allowed the life sciences company to actually own the technology and all the data that was being generated and captured inside the system. And also, this particular client was looking to improve the quality of the patient experience, to provide sort of a single point of contact for the patient to contact if they had any questions about financial assistance or how they're managing their conditions, and to do it in a multi-channel way. So they leveraged Deloitte's Patient Connect solution and were able to dramatically reduce the number of different vendors currently providing patient services, as well as do it on a single global platform that standardized the capabilities across all the markets and across all the hub vendors that were providing these services. And also, by using Patient Connect, they were able to increase the number of channels as opposed to just using the telephone to engage with patients and the healthcare providers. Opened up several new digital channels like email and portals and apps, and provided a consistent experience across those various channels. I'm not going to go into too much more detail on that case study, but I did want to provide you an example of how one company has been able to use the product on a global scale and able to standardize their programs across markets and across hub vendors. So with that, I'm going to transition to my colleague Amarinder, who's going to go into some more specifics around our most recent release of our Patient Connect product.
Thanks, Ryan. So before I dive into the demo, I wanted to share some context on the things that we'll be walking through while doing the demo. So what you see here on the slide on the left is typically all of the user personas that can be configured in the product that we've built. You would see, folks from the manufacturers or the life sciences companies, for the brand managers or the patient support program managers. You'd see folks who typically participate through the contact center or even live in some cases in the field. So there could be a data entry analyst, a care coordinator, somebody who's in the field, an access specialist, a manager of contact center agents, somebody who's in the field who's educating the patients or HCPs or a reimbursement specialist, people who are just focused on making sure patients have access and financial access to consume the therapy. And then we have the customers, which is the patient and the healthcare provider, whom we call an HCP. So all the tools related for customer engagement are focused on HCPs and patients. So for the context of this demo, we will focus on the care coordinator, the healthcare provider, and the patient. So we'll walk through how a care coordinator can use the system to manage the programs, the patient populations associated with those programs, how they can plan out the days and do the tasks related to the patient care activities that for the patients under the care. We'll see how patients how the HCPs can use the portal communities to keep their patients on therapy, and how they can enroll new patients who are interested in the programs. We'll see how patients, communities through portals patient can directly engage with the care coordinators, and we'll very briefly also touch on how we can use the system to manage patient intake using a document management workflow. They can have an overview of the provider population, which is they can look at the distribution of status, who's on what status, and then they can also look at patients who are at risk of either going off therapy or off coverage. It also provides the list of all of the patients who are under the care of a particular physician, and then care coordination alerts, which are the same set of alerts that a care coordinator sees. The physician also gets to see them. So, it enables the concept of co-production. The physician and the care coordinator can collaborate to co-produce the care for the patients who are under their care. And one of the other things for the patient portal is that physicians could also enroll their programs. There are frameworks to customize and build web forms that can be used to enroll patients, which can be routed to document queues for easy enrollment for patients, document queues of care coordinators for easy enrollments of patients. So as I mentioned earlier, like if a physician is submitting an online web form to enroll the patient, that shows up in the queue of a care coordinator, where they can do a QA and see if there is any missing information or data for that patient, and step through and enroll that patient directly into the program. So that's what we've seen, that in spite of all of the digital tools that are available to us right now, physician offices particularly still like to use a lot of faxes, and so we've gotten a request from a lot of our clients, and what we've built is a centralized document management facility where you have all of the inbound and outbound documents in one place, which you can tag, categorize, prioritize, and use that to initiate either care management workflows or do enrollment, as I said earlier, and also maintain audit log as to who worked on what document and for what purpose. So lastly, I wanted to quickly touch upon what's available for patients also to engage directly with the care coordinators, and also the program on which they're on. Typically what we've seen is patient is enrolled in one and only one program, but similar to what we saw for physician, so that it's easy for folks to consume the information that is being pushed out to us. There's a single interface where a patient could see all of the programs that are currently enrolled into one place. Over here, we have seen that our clients, again, like to work for specific branding for the programs, and so what we provide is a set of frameworks and toolkits, so that you could set up patient portals quickly using Salesforce's communities. A typical patient portal provides a view of all of the self-generated data that the patient is sharing with the program. Like, for example, in this case, in breast oncology program, rate and heart rate are one of the key measures. So a summarized version of that data is being provided back to the patient. If the patients are doing some self-reported surveys and they're being frequently reported on, the quality of life indicators which can be created from the data that's being generated from those self-reported surveys can also be surfaced back to the patients. All of the lab results that have been conducted for the patient, they're also available through a patient portal. All of the care information, care team information, and then there's quick actions that a patient can take, either to reach out to the care coordinator, submit a survey, connect additional wearable and device data. That's also available to the patient portal. We had built the complete demo, but unfortunately, due to technical reasons, we couldn't walk it through. But I wanted to make sure that I quickly describe some of the capabilities that have been enabled in the product. So I think with that, That's all we had in terms of prepared content. I know there was some questions coming through, so I'll hand it over back to the moderator.
All right, great. Great presentations there. Now it's time to move on to Q&A. And just reminding everyone, there's still time to submit your questions using that Q&A button in the lower left corner of your screen. All right, so we'll begin here, and this is for anyone. Feel free to jump in. First question for you: how would we begin thinking about transforming our patient services capabilities?
Hi, this is Chris. I think I can jump in and take that. When we talk to our clients about the journey and the transformation of patient services, it usually starts with a discussion of what their key therapeutic areas are, what are the dynamics in those areas, is there a launch coming, is there a competitive threat in the marketplace, are they in a crowded market, or are they a unique therapy? So to start the patient services journey, we tend to think about the brand strategy itself, what the environment looks like, where services would benefit that specific brand or therapeutic area in the marketplace, and what experience the biopharmaceutical client has already in that space in patient services. Sometimes there's older programs, maybe a limited number of channels, maybe there's a call center we could leverage where patients have been able previously to call for support, and we could look at opportunities to expand that. But typically we would start with a strategy and a use case around what's the key objective for engaging patients, what are the therapies and therapeutic areas that are critical to that company, what's the competitive landscape look like there, and then what are the enablers we can leverage that exist today, and how would advanced capabilities like Patient Connect be able to build a broader, more engaging patient ecosystem for that client.
Okay, great. Next question for you. Where do you see the most activity for patient services offerings?
For us, the key points of high activity are revolving around the care areas in which we're talking about chronic disease states, long-term care, especially where we're talking about those things in conjunction with expensive therapies. So immunology is a very big market for patient services. Diseases like psoriasis, rheumatoid arthritis, multiple sclerosis. Diabetes is a use case we're talking to a lot of clients about, especially where there's a patient with type 2 diabetes on what will ultimately be a long journey across potentially a number of different therapy types as their disease state progresses, and also as a disease state which in theory we could really impact the curve, although we see a lot of resistance from the patient population in getting healthier and really addressing their disease state. But if we did, if we were able to inflect that curve through patient services, we might be able to keep patients on the less expensive therapies, the less invasive therapies for a longer period of time and really drive a transformation in the treatment curve for that disease state. We also see a lot of activity in oncology, both the oncology therapies that are longer term, where maybe you're managing the disease state with some of the newer novel therapies, and also, unfortunately, some of the more terminal types of cancer where adherence is critical to the length of duration of survival, and the drugs can tend to be very either complex to administer or difficult on the patient with a lot of side effects and a difficult side effect profile. So the oncology space is busy as well.
Okay, great. Here's another question for you. How do you reach patients that aren't as tech-friendly?
Hey, Chris, this is Ryan. I can jump in and take this one. I think the benefits of the multi-channel engagement platform account for that. I think in many cases, companies still have field-based nurse educators, which I spoke about, as well as patient support specialists who sit in the call center. There are definitely certain therapeutic areas and certain products that are used to treat older patients. And you're right, we see it all the time where the number of those older patients who actually use mobile apps or who want to log into a portal or a website for information, is sometimes low. In some cases, they do use it, but in terms of the overall patient population, the numbers of people that are interested in sort of digital engagement is low relative to other therapeutic areas that may, for which you may have a slightly younger patient population. So through field-based resources, field-based nurse educators and clinical coordinators, as well as patient support specialists who reside in call centers.
Okay, great. Here we go. Is there a provision for reimbursement for HCPs for providing these services, or is the entire cost borne by manufacturers?
So typically for these programs, we see the manufacturer is absolutely funding the program. So implementing the technology, as in our case, right, cloud-based technology usually, but still implementing and owning the technology. They collaborate with call center vendors who are, answering patient calls usually as a primary entry point for the pharmaceutical company. From an HCP perspective, what we actually see, and this is critical to successfully implementing these types of services, is the question for the HCPs is what value is the biopharmaceutical company providing to them that would encourage them to recommend the program to their patients. So when we look at setting up these programs, we typically work with our biopharmaceutical clients to make sure we're offering value add to the HCPs in the given market, and that varies significantly by geography, but for us in the U.S. market, it tends to be relatively easy. If the pharma company can implement a patient services program that, for example, takes the load off the HCP and their office staff for doing prior authorizations or benefits investigations and managing potentially yearly renewals of coverage for the patient on that therapy, that's a great way to get the HCP office engaged in recommending the program to patients, getting them to sign up, and therefore getting the patients into the program, which is really what our biopharmaceutical clients want. Right? They're happy to pay for the programs if they get good receptivity, a significant amount of the patient population signing up, and the best way to do that is by making these things value-added services for the HCPs around that patient service space. Can we help them get on therapy? Can we help them get reimbursement, right? Physician's office doesn't want to spend a lot of time of office staff on that if they can help it. Can we get them trained on the therapy if it's an injectable? Those are the types of things. So that's the real interaction we see between biopharmaceutical company and the HCP in this space. It's adding positive value that the HCP can say, yep, this program is good for my patients, helps me, makes it easier for me, and therefore I'm going to recommend it.
Okay, great. There is a lot of patient data in the program. How are data protection laws managed in your service?
So this is Aminder. I can take that one. So there's actually three levels at which you would put your data protection or data management program in place. One is obviously across the users. So the platform itself, which is Salesforce, comes enabled with two-factor authentication. It allows for sharing rules so that only the things that the care coordinator is supposed to see, they should see, and only the things that the patient is supposed to see, you can see. So you can put permission sets and sharing rules to prevent people from seeing the information that they don't have to see. The second part of the data protection is the Shield enablement. So when the Salesforce Health Cloud comes up with the Shield protection, so our product is Shield enabled. What we typically work with our clients is get a list of data elements or fields or chunks of data which are sensitive and need to be protected. And you could put encryption in place using the Shield protection mechanism for that. And the third part is, which requires solutions beyond technology, is if the data is going out of the platform. So if the data is staying in the instance that you have on the Salesforce platform, then you could use first two elements that I mentioned. But if the data is going outside, then we work with our clients to have a confidential information management plan put in place. So that would require policies to be put in place beyond technology, people being trained how to use the patient-sensitive data. So we typically, there are some things enabled in the product, and then we work with our clients to put other plans and policies in place so the patient information is protected at all times.
Okay, great. There we go. How does your system cater for patient confidentiality laws, particularly in Europe?
This is Chris. We've had a lot of different scenarios with our clients around patient confidentiality and how it applies across different countries. So we have a number of clients that have implemented our capability globally, some in the European market, some in Asia Pac, and then obviously we have North America, as we've been talking about. It does depend a lot on the pharmaceutical company's internal position on some of these confidentiality rules. But what we've seen fairly consistently and extensively in Europe, we've been very successful with, is it really comes down to the specifics of consent and consent management in the individual countries. So we've been able to, in a number of European markets, and any we've tried, to be clear, to establish a patient consent and opt-in approach that our clients were comfortable met the legal burdens of those countries and also their internal legal policies for both taking in the patient data and managing that patient data, and also covering off on some of the European data privacy consents required to storing that data as it relates to storing it in or out of country and encrypted in different types of systems. So it's not one answer, and it's not necessarily a simple answer, but it's been answerable in every case for us in about 5 European countries, U.S., Canada, about 4 different countries in Asia Pac, and in all cases it's directly related to how we're asking for consent at the time the patients opt into the services, or the HCPs in some cases opt into the services, how we communicate what they're consenting to, and how specifically we store and manage those consents. And then, as Amarinder was talking about, the policies around how we're encrypting the data and how we're storing the data make it easier potentially to ask some of those questions. So with full encryption through the life cycle, we can be very compliant with some of the different regulations and consent.
Okay, great. Has your solution, including call center and or field nurse coordinator, been used in a clinical trial?
Hey, this is Ryan. I can take this one. So we have had several conversations with life sciences companies that are looking about potentially using Patient Connect to enable the clinical trials process. At this point in time, no one yet has used the product to do specifically that, but many companies are trying to figure out how to better engage with both patients as well as investigators and sites during the clinical trial process. We have actually done work for a couple clients using similar technology, Salesforce.com, for example, based technologies, to enable that, the recruitment of patients and managing interactions with the sites and the investigators. I think Patient Connect has many of sort of the foundational building blocks that are required to do that, to enable sort of the interactions with the sites and the investigators and to do patient recruitment. Chris mentioned consent management, for example, earlier. That's obviously a big part of a trial. It's a big part of a patient services program as well, and it provides all the capabilities to capture the consent, whether it's in paper or electronically, and manage sort of that data over time. So I think there's definitely going to be opportunity, and we'll see more companies in the very near future look for Patient Connect, like solutions to enable their trials. But at this point in time, we haven't had a client use it for that quite yet.
Okay, great. Another question for you. How does this Patient Connect interface with EMR EHR?
So we've had a number of conversations around that, and the capability or the question comes up frequently. We have not had a client yet who's truly implemented the use case. In fact, we've had a lot of discussion about it and have not identified the real use case yet, at least in our current client population. I believe the most aligned case in which EMR integration would be most useful is therapies that are treated as a medical benefit instead of a pharmacy benefit. So where there's true integration, maybe infused products that are part of a broader medical benefit, potentially in the oncology space, although I haven't seen it personally yet for the oncology therapies I've dealt with. But in that use case, our planned approach for EMR integration, and this is one of the cases where we believe leveraging the Health Cloud capabilities of Salesforce will be very valuable because they've invested in some of those use cases, would be a unique integration into a particular EMR, because it would be good for the audience to keep in mind, at least in our experience, every implementation of an EMR is exactly one implementation of the EMR. Even on the same vendor's products, they tend to be customized, and there tend to be a lot of version differences and things like that as you look across a hospital network or infusion clinics or things like that. But based on the specific client use case and leveraging some of the Health Cloud accelerators, our approach would be to integrate specifically with the key EMRs that are necessary and determine the appropriate data sets to be passed back and forth. And we would need to look at those data sets as well and understand, again, the use case and what information can be shared from the medical record, as there tend to be some more constraints and concerns as you're moving back and forth treatment data and medical data versus just support type data. So it's a unique question that depends on the specific client need and the therapy and how it relates in the ecosystem. But it's a question we've talked about a number of times and certainly have perspectives if somebody wanted to follow up on it individually.
All right, we've got a couple more questions. I think we can get to maybe one or two more. This should be a quick one here. In which geographies have you been offering your platform?
I can take this one. This is Ryan. We have a couple clients that are using it on a global scale. We've have enabled programs in the U.S., Canada, Japan, Germany, the UK. And we have a client who's actively looking to roll it out to Spain, Italy, and Switzerland next. So definitely across many of the European countries and in Asia Pacific.
All right. I think this will probably be our last question of the day. If all the data is in Salesforce, who owns the data? If a company chooses not to continue with Health Cloud, what will happen to the data?
Yeah. I can answer this one quickly too as well. I mean, the short answer is the life sciences company owns the data. They're responsible for the data. They become stewards of the data. They assume accountability for managing the data. And even though it's a cloud-based platform, if for some reason in the future the life sciences company decided to migrate to a different technology or a different platform, they could choose to convert or move that data into their new platform, or they could simply shut down the application, sort of at which point the data would be purged. The data would be deleted. And I guess just one other quick comment on that topic. Many life sciences companies have different policies and procedures around the retention of this data because it's sensitive information. It's PII. It's patient health information as well. And in many cases, HIPAA consent's required to collect and manage this data. So oftentimes companies will, after a period of time, sort of de-identify or anonymize the data once a patient has left a patient services program. So just something to be thinking about is you are collecting a lot of data over time, but there is a responsibility to sort of own and steward that data going forward. And most companies put in place processes to start to purge data over time and or de-identify some of the more sensitive information once it's no longer required.
All right. Well, I think that's all the time that we have for today, unfortunately. We had a ton of great questions. We could not get to them all, but we will be getting back to everyone who submitted personally after the webinar. I'd like to thank everyone for attending this Fierce Live webinar. I'd also like to thank our speakers for participating and Deloitte for presenting today's webinar. The webinar has been recorded. You will be able to access the recording within 24 hours on the same page that you used to register for the event. Again, I'd like to thank you for joining us, and we look forward to seeing you at future events.